Welcome to Airway Breathing Conversation, a podcast presented by the anesthesiology residents at the University of Saskatchewan, created to provide individuals of all levels of medical knowledge with anesthesiology-related healthcare information. This week, we return to our series on neurodivergence in the perioperative setting. Join us as we speak with Charmaine Bellamy, a public health nurse and mother to a child with autism, as she talks about caring for patients with autism or other neurodivergent conditions and their families in the perioperative setting. Now, whether you are an anesthesiologist, resident, medical student, or member of the general public, come take a break with our host, Anesthesia PGY2 Sebastian Turcott, and a multitude of brilliant and insightful guests as we demystify the incredible specialty that is anesthesiology, one episode at a time.
All right. So hello, everybody. Hello, listeners. Welcome to another episode of Airway Breathing Conversation. My name is Sebastian Turcott. For those of you who don't know me, I'm a R2 resident here with the Department of Anesthesia at the University of Saskatchewan. And we are so excited to have another guest here today in part 2 of our Neurodivergent series with Charmaine Bellamy. Charmaine, thank you so much for joining us.
Thanks for inviting me.
Yeah. Charmaine is friends with one of our research coordinators and who also has a child with autism and has lots of experience working or presenting to the healthcare field. And so we thought it would be great to have you here for part 2 of our series. So thanks again.
Yeah, thank you very much.
Charmaine, do you mind just telling us a little bit about yourself, your background?
Yes, for sure. So I'm actually a single mom of 3 kids. My youngest is the one with autism that get to chat with you guys about today. I'm also a nurse in the Health Authority here. I worked mostly as a public health nurse for almost 20 years and now managing in primary health care. And most of my kind of acute care experiences as a mom of Luke, who need lots of time in the hospital here. Also, I have a brother who was in a serious car accident when he was 19 and became paraplegic and was in the hospital for a long time. So my kind of acute care experiences are kind of around family rather than my work life.
Okay. Yeah. And I think it'll be so great to have your perspective sort of from a family perspective, which is amazing to have you here today for that. And so why don't you tell us a little bit about your son, Luke, if you don't mind?
Yeah, it's my pleasure. So Luke is 17. He'll be 18 next month. And he was born kind of typical, born at full gestation and nothing obvious when he was born, that there was something different about him. But fairly early in his life, I think at about 4 months of age, we were recognizing already that he wasn't meeting traditional or typical milestones for development. So he started being seen at the Kinsman Children's Center for physio and occupational therapy. And as we were going along, it was around his first birthday that the team at Kinsman Children's Center brought us together and said that they believed Luke's impairments were lifelong, that they would be physical as well as cognitive. And they didn't know why, they didn't know what the rationale was, but they were going to provide support regardless. SLP, PTOT, that kind of thing. And Luke continued to receive support, and obviously as he got older, his the areas where he wasn't as strong were more and more apparent. Having a 6-month-old that doesn't talk isn't strange. Having a 3-year-old that doesn't talk, you start realizing more of the differences between them and their peers. So as he got older, it got a little bit more difficult to manage because he was getting further and further from his peers. Difficult to, I guess, manage or to know how to support him in the community. But his medical pieces really didn't come to the forefront probably until he was about 5. He was diagnosed with autism, just before his 4th birthday, just because that's when we had an assessment done, and it could have probably been done before or later. But nonetheless, around his 5th birthday, he was having seizures. And so we had him seen by neurology at that time. Yes, he's having seizures. Here's what we do to try and control those. And kind of that was that. And just worked quite a long time to try and get the seizures under control. And because my son, Luke, has a very restricted diet, which a lot of people with autism do. And if you tried to give him oral medication, he's very good at not letting you or else puking it up. So he was, because the seizures were getting worse and were not well controlled, we decided to get a feeding tube for him. So he had a Mekiji tube inserted when he was 10 so that we could consistently give him his seizure meds, which was a blessing in other ways because then we could also give him Tylenol when he had a fever or antibiotics when he had an ear infection. So it was a mixed blessing for sure. We really loved that. And it was shortly after that time that he started having a lot of pain. And Luke's completely nonverbal. So his ability to communicate his pain is very limited. And I hadn't seen him have that kind of pain before. So it took me a while to figure out that when he was screaming that way and he would start to injure himself, what it meant and that he was in pain. And so that was from about 10 years of age. And is bowel related. He's had several surgeries related to his bowel and his tummy. And so that's kind of where we are now, where he experiences pain quite a lot. I'd say about 50% of the time Luke's struggling with pain related to his gut.
Wow, it sounds like a long road.
Yeah.
Sounds like he's had lots of support along the way, which is amazing. Sounds like a lot of work for you as well, trying to manage everything for him, but that's so amazing. And so,
Thank you.
And so we'll get into the medical side or Luke's medical history maybe a little bit later. I just sort of wanted to ask you, like, what does a typical day at home look like for Luke?
Yeah, that's a really good question. And I think a typical day is, we don't know what it's going to look like on a typical day. And in part, I would say primarily because of the pain that Luke experiences and because he experiences it so often, I'm not really sure what to expect of every day. So Luke does go to school. So on the days he's feeling well, which he's able to go to school most of the time. So that's great. But we have a lot of unpredictability with what our day looks like. He doesn't sleep well, like a lot of kids with autism. He has kind of his worst nights are 30 minutes of sleep in a 24-hour period, and best nights are like a couple hours, and then he wakes up and then a couple more hours. So his sleep and my sleep are unpredictable, and then our moods the next day are also unpredictable and how we cope with things. So Luke, as far as feeding him, he needs a lot of support so he can try and feed himself with a spoon. It can be messy, but so those kinds of things, bathing him, he needs support with that. He needs a lot of support, but he's also, when he's not in pain, just the most cheerful, lovely, happy-go-lucky kid you can imagine.
Amazing. Yeah. And I think I can imagine that that happy-go-lucky attitude really comes out with all that support that, what are there any sort of specific supports for him that you've sort of worked with the team at Kinsman or his pediatrician team that you'd like to share, or anything specific that you can think of?
Probably the most valuable support that I've had for Luke is when we had an ABA, like an applied behavior analyst working with our family. So that was private. There is some kind of funding that you can access depending on your income for kids. But this was, for me, it was primarily paid by myself, but they would come into the home and look at areas that we wanted to work on. For example, I know Luke can get himself dressed. I don't know how to teach him how to get himself dressed. So she would work with us in breaking it down to really small steps. And she would teach me, but she would also teach. I have staff that work with Luke so that I can do other things, work and have pleasure. So I have support workers that work with my son regularly. So she taught me, but she also taught them how to teach Luke these skills. So that would be the most impactful support we've had for him.
Amazing. So good. And then at school, so how do his supports sort of look like at school for his routine there? Yeah,
we're very lucky to have Luke attends John Dolan School in Saskatoon. If you're not familiar with John Dolan School, it's a school that supports children that have complex medical and behavioral needs. And so it's a school of approximately 60 students. I believe there's more staff than students because of the level of supports that are needed in the school. There's nurses as well. We have they have occupational therapy that come into the school regularly to work with the students. Behavior specialists that come in and help the staff and so forth with the students. They have a amazing playground and an amazing sensory room that was developed and designed for kids like Luke. So it's really great. There's lots of opportunity there, and he has one-on-one support. So he always has an EA or a teacher with him.
So cool. Okay, amazing. Yeah, it's so nice that he gets to have those opportunities too with some of those supports.
Nice.
Hey?
Yeah, very nice.
And then with our last episode with Alex, we sort of touched on strategies, specifically in the school setting for some students when maybe they're not having the best day or they're a little bit more stressed. Do you have any strategies at home with Luke that you use when he's a little bit more stressed or just to help with a little bit of extra support during the day?
Yeah, I really appreciate that question. And so for me with Luke, if I know he's not having the best day, I know if I can give him some focused one-on-one attention for a while, that will, then that's like, I think all parents with all kids, if you can give them some attention for a while, it gets you a lot farther than trying to put them off for as long as you can. Yeah. So with Luke, I can decide to just, I was going to do this. I was feeling like I need to get groceries or feeling like I need to do this, but I'm going to stop and just, what do you want from me right now? Is it a cuddle? Is it a book? Is it playing? And that really can go a long way to settling him and preventing things from escalating down the road. Okay. Also, really gauging before trying to do something where he's at with his, for Luke, it's his pain level and so forth, but really looking and saying if he's struggling with feeding himself, which normally he doesn't, then probably if I'm asking something more of him, it's not going to go very well. So really paying attention to his current state before determining if I'm going to push him to something else or if I'm going to just say, hey, let's have some free time, let's relax and not push you harder. So, and I think that's valuable for all humans, not just children and not just children with autism, but really respecting where he's at. And it makes such a difference to not try and force something that probably isn't going to be successful.
Okay. Sounds good. And that might be a nice way to transition to sort of his medical experience a little bit too. And so specifically, we're sort of wondering about, it sounds like he's had a few surgeries in the past, for better or for worse. Do you mind maybe just overall, like, what was your experience when he first had his PEG tube placed sort of early on as a child versus maybe later on in life with some of his later surgeries? What were those experiences kind of like for you?
Yeah, I think all of Luke's surgeries have been planned. So we had the ability to plan as much as we could. And while his first surgery was his first surgery, it wasn't our first encounter with acute care. So I was prepared in that way, as was Luke, to the environment, the rooms and acute care and so forth. So that was helpful for us to have that, to know what to expect. That was prior to JPCH being open. So what it looked like was a lot different than what it is now. And it's definitely more family and patient-centered now, which is great. But it was interesting because with Luke's first surgery, I was unsure what to expect for him. And getting a feeding tube felt like a really big deal. Now, in hindsight, it doesn't. But at the time, it felt like a really big change for us. And so I had someone, there was a student working at John Dolan, I think that, or maybe at Kinsman Children's Center. There was a student occupational therapist, I think, or SLP, and I asked if they would help me put together a, story for Luke, just a picture story to help him prepare for the surgery.
So cool. Yeah.
Yeah. So the student did that. And I read it to him like several times a day prior to the surgery. And I thought, this poor kid who I can't really verbally communicate with, how he's going to wake up with this tube. And I'm assuming he's going to rip it out, and try and rip it out and so forth. Yeah. But we went in and out, and it's like when he woke up, he looked down like, thought that would be there. And it was interesting to me because there was no indication that he understood what I was telling him or what the story said. Yeah. But clearly he was not the least bit surprised to see it there. Okay. So it was really cool to have ways to try and communicate and prepare him. At that time, the parent being in the OR was not typical, I guess. I think it is with JPCH that parents can come in while kids are starting off.
For sure. I haven't done my pediatric rotation quite yet, but I have heard that it sort of goes on a case-by-case basis for sure to try and be as supportive as possible for parents.
Yeah, so in the beginning, when Luke first started needing to be in the OR, it didn't sound like that was typical practice that parents would be allowed. But each time he was to go in the OR, the team, whoever that was, whether it was nursing, surgeon, anesthesia, always were asking, did I want to come into the OR and what would be helpful? So that was awesome. And also at that time when the kids go to the recovery room, the parents weren't allowed to be in the recovery room when they woke up. They had to wait till till the children woke up, and except I didn't. They're like, we're not sure how he's going to respond when he wakes up. Would you like us to bring you in ahead of time? And I always took advantage of all those opportunities, and I was really grateful. And I also thought that kids without autism probably deserve that same option.
Yeah.
That I felt bad that I was the mom in the room that got to go in before their child woke up, and it was interesting because I think the professionals offered that to me because they wouldn't know how to handle if something happened, like if Luke really escalated or started ripping things out.
Yeah.
But I could have confidently told you he won't do that. And but they still wanted me in just in case because of the unknown, which of course I'm very happy to be there. But I did feel a little bit like I didn't deserve this privilege over other children who might wake up frantic and not have autism. So it was interesting. But I really appreciate it. And I appreciate that it seems that option, like you say, goes by case by case, and it's not specific to a child with autism or something would have that. But the other thing I really loved is that from the beginning, like Luke, like a lot of kids with autism have a lot of sensory issues. And so cutting Luke's nails is like I got carpal tunnel from like I have to really restrain him to cut his nails. It was one of my least favorite tasks for me and Luke's sake. And so anytime he had to go in the OR, I'd be like, can I come in and cut his nails while you guys, always they said yes. And so it was so great
cool.
that I got to always go and cut his nails. And one time he's in kindergarten and we got like, I don't know if you guys have kids, but got like the lice letter that says someone in the classroom has lice. We appreciate everybody checking. Well, I cannot touch Luke's head. I can't look through his hair. So the one time, like, can I cut his nails and do a lice check while you're in there? The cutting nails, they were a little more comfortable with the lice check. I was like, oh my gosh, because you have lice. Anyways, he didn't, but they were just always so gracious to kind of sneak those things in while they were in the OR. So I really appreciated that they understood and they were willing to let me do that.
Oh my goodness. I'm just trying to imagine the OR staff reaction when, I mean, he may have lice. Do you mind if I just check? Like that's...
Exactly. And being a public health nurse, I deal with lice. I had dealt with lice a lot. So for me, it's nothing. But yes, there was a little bit of people walking backward when I...
Unfortunately, maybe in the OR, we're maybe a little bit type A and we like a clean environment, of course.
I'm sure.
So the idea of lice in the OR, maybe a little bit off-putting.
People weren't excited, but they let me. So that was nice.
Oh man, that's so cool. It sounds like... being able to adapt to the patients a little bit is a huge benefit for families. And it's so enlightening to hear your perspective on what other parents might feel too, who don't have, a child who's neurodiverse, but who would still benefit from seeing their parents early. I think maybe just a quick plug for JPCH now is the wake up rooms that we have for patients are all individual.
Nice.
I think parents, they're able to be there with their child right before they go off for surgery.
Good.
And I think they get to come back a little bit earlier now with that versus on the adult side. So definitely a nice plug again for this new hospital that we have.
Yeah, I really appreciate that.
Amazing. Yeah. And so it sounds like it took a while to understand the adaptations that Luke would need for you as a parent and trying to figure that out along the way. As anesthetists, we have maybe 15 minutes to try and get to know our patient, build rapport with them, earn their trust because we're going to be putting them off to sleep for a surgery, and developing that connection to them. Do you have any advice, any suggestions, any experience you can draw from for anesthetists who are working with patients with autism or other cognitive disabilities in developing rapport with them early on so that to try and gain that trust with them before their surgery?
Yeah, like it's interesting that you say you have about 15 minutes because I'm not saying this to brown nose or anything, but my experience has been that the anesthesia team is always very good. I've never had a negative experience with anesthesia where it's always very good as far as using that 15 minutes to the best of your ability and really connecting. The things that have meant a lot to me are that anesthesia, when we've been admitted, will come up prior to the surgery, and go through things ahead of time. But even if not, if it's just right before the OR that we meet you for the first time, they're asking questions, giving eye contact, and really allowing for an exchange of questions and answers. And I feel oftentimes that medical team is kind of moving on to the next thing. in their brains while
Yeah.
I'm still trying to figure out this thing.
Yeah.
And so it's hard for me to feel like I can actually ask a lot of questions about what to expect and what's happening now.
Yeah.
And I've never felt that way from anesthesia. So I would say kudos, and also keep doing that where you can actually have a conversation and I don't feel bad to ask, I just have one more question. Or I can ask, I hear what you're saying, but I don't really understand why you're going to do it that way. And I don't feel that anesthesia's ever felt defensive when I ask why you're approaching it a certain way. My experience has been really good. And when I ask why you're doing it a certain way, more than happy to educate me on that and not think I'm attacking or discouraging, but more just trying to understand why we're doing what we're doing. So I think anesthesia is really, my experiences have always been really good. So getting to know them, that 15 minutes, that rapport helps a lot. And with Luke, I think, and I'm not sure how you guys do this typically with families, but oftentimes I'm asked, like, is Luke okay with me touching him, or is he okay? Which I think is really respectful. And I think Luke's unique in that of people with autism, he's probably the only one I know that loves physical touch as much as he does. And so that would be useful for Luke if anybody who's working with him wants to sit down beside him and wants to, touch his hand and show him we're going to put something on here, and maybe touch him in a positive way before in a painful way with an IV or so forth. And and those kinds of things. But I think eye contact as well. Like it's interesting to me how many healthcare providers are looking at their board, their task board.
We've got things to ask and we're just going to ask them.
But that eye contact and human contact of just acknowledging the human stuff in the room is really helpful for building rapport and trust.
Yeah, so cool. I think this was mentioned in the last episode as well, but just speaking to the patient, rather than just the parents the whole time too, and involving the patient in the conversation prior to going off to surgery.
Yes.
Yeah.
And I could add to that because my son is nonverbal and isn't able to communicate back, a lot of healthcare providers are really good at starting to communicate with Luke. And then as they're asking questions, it has to be me answering because Luke can't. And then the conversation goes to me and the care provider. And I think that there's a way to incorporate both, and acknowledge my answer and then say, okay, Luke, I get it. So your mom's saying, that you prefer this. I've heard her. Don't worry. I got your back. I'm going to make sure to keep that in mind, and still including Luke in it. Yeah. But it is, I think, natural because I'm doing all the talking for, of course, the provider to focus on me.
Okay. Amazing. And so you mentioned Luke's had a few different surgeries. Has he sort of gotten used to the routine of coming to the hospital for a surgery? Is it new every time for him? Do you have strategies on how you prepare him for an upcoming surgery? You said they've all been scheduled. So
yes. Yeah. I would say his experience with acute care isn't positive.
Okay.
So there are times like when we used to be in the hospital, he was admitted probably monthly for a year or two with pain-related pieces. So just driving past the hospital, he'd start crying at a certain point in time. So even though he knew more what to expect, that wasn't necessarily a good thing, and so it could make things a little bit trickier. But I guess over time, just for me, the communication and for me being Luke's voice more over time has been helpful. And certainly anesthesia's role, I don't know, does the world revolve around you guys? Because when we're up in acute care prior to the surgery, it's like he can't eat or drink or have this medication or everybody's scared of anesthesia. And it's hilarious because Luke will be unfolding. Like he'll be on the ground screaming and maybe banging his head into things because he's so hungry or he's so frustrated and people don't want to, give food and drink, fair enough. And also are really reluctant to give like Ativan or something because he's going to be getting other sedatives when he's in the OR. And each time when I press it enough, they'll call anesthesia.
Okay.
And then anesthesia says, yeah, go for it. Whatever, it seems like it's never a big deal to anesthesia, but the ward is so careful. And so I'm thinking, I push them enough that they'll ask somebody and we get something for Luke, whether he can actually have something to drink or, whether he can have some medication. We usually get what we need to calm him down a bit. But I actually wondered if does the ward staff know that there's flexibility that it's individual, that if all hell's breaking loose, they should call anesthesia?
I think you bring up an amazing point, and maybe something that we can take on knowing, like, if we have a patient like Luke who's scheduled for surgery and he comes with his own specific supports that could help improve his experience, to try and maybe see him a little bit earlier as a team, knowing that he has an upcoming surgery. I can wholeheartedly say that whenever the nurses do call down and ask for something, I think we have an amazing department. We have some amazing people that work here. They're always willing to adapt to the patient. I think as long as it's safe, right? I mean, of course, the no eating thing is very important just from a safety perspective. But so I think maybe there's this notion that these are hard set rules, right? But you bring up an excellent point that we should adapt things for certain patients to try and improve their perspective. So I think that's something that we can take from your feedback. And maybe seeing patients a little bit earlier, coming up with a plan while they're in the hospital room waiting. And I know we always touch on, we try to finish these cases maybe earlier in the day so that
that's so helpful.
Patients like Luke aren't waiting hungry throughout the entire day. So little things like that.
That is a really big deal, yes.
Do you have anything else that you can touch on with that?
Well, I was thinking about that. What other things have worked? Oh, the other thing that really works for me, Luke, at home, that also is helpful in the hospital setting is, for example, if I need to go get groceries and I'm bringing Luke with me, if I get him dressed, get his coat and boots on and get all of his stuff ready and then go get my stuff ready, he'll be frustrated. He's like, I thought we were going somewhere. And now we got to wait for mom to go to the bathroom, to grab her stuff, to get her wallet, all that stuff. And he might be undressed by the time I'm ready to go. So it's way better to get everything ready first and then be like, hey, we're going. And so when that's possible with the OR, it's so helpful. And I know JPCH is so much stronger in this area than what we had before JPCH as far as get everything ready, then call Luke down, because sitting in a sterile or semi-sterile environment with none of your comforts, and that's kind of a scary place to be. And we're waiting for everybody to get the OR set up and stuff. It's just heightening his stress and mine. So it's nice if you can do everything possible ahead of time, then call us down, and then, then we get Luke going right as he's going into the OR versus having to wait for a long time before.
Okay. It sounds like just that extra little bit of communication maybe from the OR team to the rest of the medical team on, how are we best going to plan around this case to be the most supportive as possible? Is that sort of...
Yes, I would say exactly. And where there's flexibility to maybe just communicate that there's room for flexibility. We don't necessarily know what we need right now, but like if things are going all chaotic, then call. We might be able to change things around a little bit. And like I get that there's, times where it's whoever needs to bring Luke in his bed to the OR, that's when they're available. So that's when he's coming down. It's not, but if there's an opportunity, like, in this case, Luke can walk. It's fine if we don't use that person. So if Luke's going to get agitated coming earlier, are you able to walk with him down? And maybe it's a possibility, maybe it's not, but
Yeah, amazing. And then you mentioned Ativan. Sometimes we use pre-medications with patients just to try and help relax them, because the hospital can be such a stressful environment, like you said. And Luke's had a few triggers in the past, it sounds like, that have been stress reactions for him. Can you touch on that a little bit? Like, are there certain medications that help with Luke? Are there strategies in giving him those medications? Because you said he doesn't take anything orally. Any strategies with that?
I think that's one of those great things when there is time to plan ahead. If, because Luke always has, let's say, Ativan on his MAR. And so whether he's going to the OR or not, that's on his MAR as an option. But then my experience has been that staff are not comfortable giving it day of surgery. So even just reviewing that with me and staff, prior to, and saying that we're comfortable with this amount of sedating medication or whatever. And I know when Luke's going down, and maybe nobody else would even notice, but when you've been around your kid for 18 years, you do know that little sign is telling me he's coping right now. So you may not realize that we're about to spiral down, but I do. So if we can give him the Ativan now, rather than wait till we've got
more
chaos.
monitoring, or sometimes
Yeah, and just being responsive. And I think maybe even sharing with families that this is an option. Some kids, they might not know that. Some kids get quite anxious ahead of time. Some families will choose to use some Ativan or something. We can prescribe that, or if you don't want it, that's fine too. And just maybe going through with families what options they do have, rather than assuming that they don't have any options that way.
Okay. So involving the family in the discussion a little bit sooner, coming up with a strategy. Hey, I think you have such a cool perspective working in healthcare, but then also having this child, having Luke, who has had multiple experiences. Do you find you have a different perspective a little bit on things?
I think I might, and I think I have maybe not higher. I think I have high expectations. I don't think that we need to do things the same way for everybody. And depending on your personality, some people are quite routine. This is what we did with the last kid. This is what we're going to do with the next kid and the next one. And this is how they're comfortable. As a nurse, I'm comfortable connecting with the family. What works for you? Just because we've done this before does not mean we have to do it again. What are some things that, and having those. So I like having been in the healthcare system, knowing that I have the ability as a healthcare provider to make this work for you as best as I can. Can't do everything you want, but I certainly can chat with you and find some ways to meet you halfway. As a parent, I don't know if I would know that otherwise. So I think when parents don't know that they don't even ask for it. And so if I was to coach parents, I'd be like, ask for whatever you want. Like they can say no and be okay with that when it's a reasonable no, but you can always ask. And so that's, I feel grateful that I know that there's no harm in asking and letting people know.
Amazing. And I think that's, such a great reminder that, and I think most people who work in the healthcare system are really well-intentioned, but maybe we don't do a great job of asking, or maybe we're stuck in a routine a little bit too much. And so just being open and upfront with parents and asking them how we can make this experience better for them and their child. Hey,
And I think even giving some examples, because I know when somebody says, is there something I can do to make you more comfortable? It's like, no, I'm going to the OR. I feel scared. I'm nervous. I feel like I'm going to throw up and I don't know if I'm going to survive. People don't know what to ask for. So I know, again, as a healthcare provider, that when I'm working with families, I'll often say, some people prefer this. Other people rather me never do that, and other people have tried this and it works for them. And just giving them an opportunity to where they can see where the healthcare system has responded to a family's need creatively allows them to start thinking beyond, I'm just scared. I don't even know what to ask for.
Okay. Yeah. So offering some suggestions.
Yes. Some parents love being in the OR. Some don't,
I mean, you don't know what you don't know as a parent, I suppose. Hey, because this is such an unfamiliar environment for the parents too. Yeah. Okay.
Exactly.
Any other suggestions that you have for parents who maybe are a little bit newer to this? They know that their child might have an upcoming surgery, what to expect, how they can prepare their child a little bit, because it sounds like you have such amazing experience to share with people. So
thank you for asking. One of the things I learned along our journey with the healthcare system, because Luke's, again, nonverbal, and because he was experiencing pain for a long time, we would present to him. I didn't know what was causing the pain yet. Neither did the team at the hospital, and would often kind of ask me, are you sure he's in pain? And maybe it's an ear infection. And I'm like, no, this is way more serious than that, and then we had like years of trying to figure out what was actually, like literally years of trying to figure out what was bothering him, where he would be in so much pain. And I'd be really like upset and crying. Luke would be crying. And when you come and present to somebody, whether it's anesthesia, whether it's pediatrician, whether it's somebody in Emerge, they just know you in that moment in time. And so if you verbally say like, we're at the end of the road here, we are exhausted, we're trying to figure out what's going on, for that healthcare provider, it's just in that moment. Like you can hear the words, but actually understanding what that means to me, how would you know? And so it was, I think, 3 or 4 years into us accessing care very regularly that Luke was admitted to peds, and the team came in. It was the pediatrician along with the residents. And I said, do you mind if I share with you our story before we get into the medical piece? And this pediatrician, she knows who she is. I can say Dr. Zhao, Linda Zhao. She said yes. And I just told her a story. We've been doing this for how long? We keep coming to emerge and getting sent home. We keep, being given antipsychotics. He falls asleep, gets sent home and come back. And I'm just so tired. And I've watched my son struggle for this long. We've been to Edmonton. We've seen the specialist here. We've done all this. We still don't have an answer. And I don't feel, and I would just explain how I feel. And this one time I had some of the residents had tears in their eyes, and they sat with us for 20 minutes and listened to our story. It was mostly emotional where I was at and where Luke was at. And after that, I felt like they knew who I was. They knew where I was coming from. Yep. It was more than that acute care admission. And it became more than that, where I felt like we had trust now. And when I asked for something, they knew that maybe there's more to it than what they're seeing, what I'm asking for, whether it's Ativan again, or whether it's I need a nurse to help walk him around for a bit so I can catch my breath, those kinds of things. And so I just recommend, so now when I have a new provider working with us, I always say, do you mind if I tell you our story? Yep. And I don't think anybody would be comfortable saying no when you say that.
Of course,
so everybody always says yes, whether they want to or not. And then I share, and then I always feel like we can move to a better place. Like, the medical piece, but now some of the story where Charmaine and Luke are coming from. So you're more able to put that into your picture. So for parents, I really recommend asking permission to share your story, to share where you're at, so that when you're asking for things, the providers have context for that. And it might feel a little bit more like a team rather than us versus them. And I think the other thing for parents to know is that I could not understand why the nursing staff were not more supportive initially when Luke first was admitted. And so what I would see is my son, we didn't know why he was in so much pain, but he's screaming in pain. He's in the hallways, literally banging his head against the floor, grabbing things off the stock carts and throwing them around and screaming and running. And the nurses for the most part, didn't even look at us when those things were happening. In my mind, I'm thinking, don't you know, this is like, the world is falling apart here. Why aren't you offering any kinds of support? Do you want medication to help settle him? Do you want... And I realized over time that these are really good caring nurses for the most part. I think they just didn't want to draw attention. Like, they didn't want to look at me and Luke and make me feel bad that he was... And so I realized that it might seem obvious to me that I am losing my mind, that I feel so bad for Luke, that he clearly needs somebody to come and step in and find ways to support him with medication or whatnot. And why do I have to ask when it should be so obvious? But I realize it's not obvious. And so I would say to parents that if you think your child needs something, don't assume that the medical staff, whether it's nursing, physicians, etc., know that. They don't know what your child's like on a typical day. So how far are we from typical? I think it's important to know that you can ask, say, yes, thank you for giving that Tylenol. However, my son's still really experiencing pain. Even if nothing's else ordered, can we look into this because they're in pain? So I think parents need to ask more and respectfully ask for more when they think that their kids need more.
Amazing. Yeah. Being that advocate for your child, but also framing it in a way to help the medical team understand.
Yes, exactly.
And I think you bring up such an amazing point that as healthcare workers, we're all really good people. We're all well-intentioned, and we go into healthcare because we want to help others.
Yes.
And maybe that not acknowledging what you're going through is maybe we're not always trying to put the pressure on you. Maybe it's sort of how you're framing it. But that, we can still try to take the initiative to help you out as much as we can, but it's just sort of that back and forth partnership with patients and their families. Hey?
Exactly. Yeah. And I think for parents to give the staff the benefit of the doubt, and for staff to give parents and the kids the benefit of the doubt, goes a long way. So if we can just assume that you want my child to feel good and I want my child to feel good, we can work together.
Everybody has the same goal in mind.
Yes, exactly. We can do this.
Amazing. Well, thank you, Charmaine, for sharing with us. Is there anything else you wanted to add?
You know what? There is one thing, if I can. I have a pet peeve, and it's been really significant for me and Luke, is that I have I would say almost all care providers, when we're in the hospital, I'm thinking of admissions, almost all care providers will say to me, you know your child best. And when they do this, what do you think it means? How do you think we can best respond? How can we best prepare? All the good questions you're asking. And sometimes those care providers act like they do think I know best, and they respond well to suggestions. There are also a number of care providers that say, we know you do best. We trust that you know your son best and what will help him, and ask for the questions, but don't respond in a way that they do believe I know best. And they continue with what they were planning. No, he's not in pain. I was literally told my child was not in pain because he wasn't verbalizing anything. And I could see he ended up, he had like an abscess after a surgery that was developing. And it wasn't until that person was off, that physician was no longer on the resident actually came on that evening and ordered some tests, and he needed to go back into the OR, and there was a lot going on. So it was, I guess what I would ask is that to really be thoughtful about the questions you're asking. If you're asking me what will help Luke, I don't expect you to do everything I'm saying, but I would like to see that you do trust my judgment.
For sure.
And when I had people ask me and then do something completely different, and they say, I know you know best, but I'd rather you not say, I know you know best. I'd rather you just leave that out of the conversation. If you're going to say anything, say, I think I know best here.
Let's just say it how it is.
Honest with
right?
you.
Yeah.
I know best here. We're going to do what I think.
Right.
So it feels patronizing, and it breaks trust, I guess, if somebody says they want to include you in the team and in the decision making, but then there's no evidence of it afterwards. So I really appreciate if people can be true to their words. And if that's who you are, where you're not going to put a lot of thought into it, or you've heard me out and you think that's not going to roll, then just be honest, and say, appreciate your input. I'm sorry to do my due diligence. I can't do what you're asking or whatever.
Yeah. Well, I think that's such an important reminder as healthcare workers that, again, our actions do speak louder than our words sometimes. And I think, thank you for sharing that perspective, because it must feel so disheartening as a parent and as a healthcare worker, somebody who works in this system and deals with families on a daily basis, to understand the importance of feeling like you're heard by the team. Hey,
that's really important.
Yeah. And like, I can think of some of these strict OR rules that we talked about a little bit earlier, and some of them are really important. Patients will ask me, why can't I eat right now? Why can't I have this certain medication or something? And I find sometimes just taking 30 seconds to explain the safety issues around not eating before surgery or whatnot just helps frame it so that it feels less like an institution and we just have a set of rules and this is what we're living by, versus here's the idea behind it. And maybe as healthcare workers, we do these things every day. It just becomes routine for us, but for patients who are coming in, it's not.
Yes. And if I can give you an example, a positive example I had, we were waiting for some surgery, some exploratory surgery that I was very anxious to have done, hoping to get some answers around his pain. And we had, do the NPO thing, come in. This is JPCH, so it's more comfortable and stuff. But being NPO is a really big deal for me and Luke. And anyway, so there's a lot worked up. But then you get there, and Luke was healthy. This was during COVID. And so they go through all the COVID screening questions. Yeah, we're all good. And then they do the COVID test, and they came back in and said, Luke tested positive for COVID. We can't take him in the OR. And I was like, No, you've got somebody else's test results. He has no symptoms. We've been waiting for this OR time. We've been in PO for whatever. Please. And I actually asked the nurse, I'm like, I trust you, but I need to see that myself. I will not forgive myself if I walk out of here without seeing that, because it's so hard to get us to this point. Anyways, so she did. She was kind enough to do that. And we had to leave and not have the surgery. And I brought it up at a following surgery. I was just talking to anesthesia while we were waiting to go into the OR and just had mentioned this. And this anesthesiologist had taken the time to explain why, if there's a positive COVID test, even if they don't have any symptoms, what the risks are. Yeah. And because I'm thinking, if someone's in a car accident, you're going to do surgery whether they have COVID or not. Yeah. And so this individual did go through like this is what the data shows us. If we take him into the OR with COVID, these are the risks. And it was just so helpful to have somebody just explain why I am taking my son out and not having this critical, exploratory surgery done. And it was just so helpful to have that extra information about why. And it continues to build trust rather than me being frustrated that you guys don't understand how bad we need this.
Okay. I can say, Alan and I started residency sort of at the tail end of COVID.
Okay.
We had that conversation a lot
Many
of times
times.
with patients, but when we did, I found when we could frame it for patients, it always made a little bit of a difference. So yeah,
it's good.
Well, thank you for sharing your perspective with us today. It's truly a blessing, and I think there's so much that we can take away from your experiences, both healthcare professionals, parents, future patients. Again, anything else you wanted to add, sort of?
I think I'll just leave it with, I appreciate you inviting me, and that our experiences have been difficult, and it helps me feel valued and like our experiences are valuable when I get to talk about them and get to talk about the things that worked well and the things that were harder. It brings kind of more meaning to those experiences. So being invited to share and for you guys to take an interest is meaningful to me. So thank you for that.
Well, thank you so much for sharing. Thank you so much for your advocacy for Luke and other patients as well. This has been so enlightening and educating for myself, and I know for our listeners as well. So thank you so much, Charmaine. Thanks. And so just for our listeners, we will have one more part on this lecture series as well, or not lecture series, but podcast series, where we'll have a few anesthesiologists who have been involved in the autism pathway here in Saskatoon, sort of the development of the pathway and how it's progressed over the years to help support patients like Luke and Charmaine. So thanks for listening, everybody, and we'll talk to you again soon.
You've been listening to Airway Breathing Conversation, a podcast hosted and presented by the anesthesiology residents at the University of Saskatchewan. Please note that while this podcast is run by healthcare professionals, it is intended for educational and entertainment purposes only. We are very thankful to our guests for taking the time to share their wisdom with us this episode, and a very special thanks to you, our listeners, for tuning in. Don't forget to follow us and our associated USask Anesthesia accounts on social media. You can find all our social media links on our Linktree page at linktr.ee/abc_podcast. You can also find the department's social media links on their Linktree page at linktr.ee/usask_anesthesia. We'll see you next episode, but until then, stay calm, take a breath, and always remember your ABCs.